2010, the Matthew J. Morahan III Health Assessment Center for Athletes was established in honor of Matthew J. Morahan, with a vision and focus on preventative screenings as well as education and evaluation of sports injuries. Today, the center now partners with over 20 schools and has screened over 20,000 students in the state of New Jersey.
It's incredible to see how the Morahan Center has grown over the past number of years and really been able to meet the needs of the community. More and more children have entered sports, and we are thrilled that the program is beginning to offer more services to the ages 5 to 9-year-old.
As a completely mobile program, the Morahan team travels throughout the state to conduct cardiac and concussion screenings.
Well, when the Morahan Center came in 3 years ago to offer the free cardiac screens, over the course of those 3 years that we've worked with Morahan, we have found 2 or 3 abnormalities with our athletes.
When the Morahan Center partnered with our school to come in and do these screenings, it was a huge surprise when RJ went to the screening and then was diagnosed with Parkinson-White syndrome.
Knowing that the people that you have screened that may come back with something now have an awareness, now can get the treatment that they need, and that can be playing safely.
All right, Whites, go!
By offering preliminary medical screenings, we hope to identify young athletes who should be further evaluated. Our primary goal is to educate about concussion warning signs, symptoms, and ways to help prevent sudden cardiac death in youth sports.
Probably about 3 years ago, we had a pretty crazy tragedy here happen at the school.
2 students who passed away from what we were told were natural causes. And there's absolutely nothing natural about 18-year-olds dying from heart-related issues.
They contacted us and mentioned that we've been chosen to provide cardiac screenings to our athletes. And I'm proud to say that we've screened about 249 kids at our school.
At the Morahan Center, we are at the forefront of concussion management through our advanced testing and rehabilitation for even the most symptomatic of patients. We have had great success not only getting them back into their sport, but also improving their quality of life.
After my concussion, I had a few challenges. I was dizzy all the time. My headaches were really bad and I couldn't concentrate in school.
The Return to Play program, I believe, really helped her a lot. Week by week, she actually saw improvement and progression. They did get her up to speed where she was ready to go back to play. And that's something she can't get through just a visit to the neurologist. She has to actually go to the center to have that happen.
I have watched this program grow into a leading comprehensive resource for sports injury management by delivering targeted programs throughout the state.
The relationship with RWJ Barnabas Health has been phenomenal. They've been a godsend to us because they've allowed us to partner with them and offer a robust curriculum that deals with such things such as the proper nutrition and sport injury prevention for our children.
Through the Morahan Center, we've been able to just create more and more relationships and really capitalize on these opportunities to work with our youth and meet their needs as best as we can.
The most important thing that we see as a school district is having these parents entrust us with their child. And if we can provide a safe and rewarding environment for them is probably our #1 goal.
We have to hold on to the idea that our children are safe, and we forget that they're not safe all the time. And so this is an opportunity, one more thing we can do, like locking your doors, putting your seatbelt on, get your child tested, and he or she will be safer.